Hi everyone, Patrick Meninga here, spiritualriver.com. I want to talk to you today about teen pregnancy, drug abuse, drug addiction, and alcoholism. Now obviously the rates of teen pregnancy are a lot higher among the drug addicted and alcoholic populations. So if you have teens that are using drugs and alcohol on a regular basis, then their rate of pregnancy is going to be higher for obvious reasons. That shouldn't really come as a surprise to anyone. But what might surprise you, or what might be vital for you to learn, is that treatment centers, as a general rule, will prioritize a pregnant female over any other type of client. In fact, many treatment centers, if somebody calls up and says, hey, we've got this girl here, she's struggling with addiction, she really wants to get help, and she happens to be pregnant, that treatment center will generally, as a rule of thumb, will drop everything and get that girl into treatment as quickly as possible. So if you're in a situation like this, or if you know someone who's in a situation like this, I would encourage you to do everything you can to encourage the woman who is pregnant to get on the phone, call up a treatment center, and get the help that she needs immediately for both her own sake and the sake of the baby. So teen pregnancy, definitely a problem among alcoholics and drug addicts and those populations that are at higher risk. And it's important to know that treatment centers will prioritize those cases. So if you've got someone who's struggling and she really needs help, get on the phone, call up various treatment centers, see what it would take to get her in. And what I've learned is that most treatment centers are going to bend over backwards to get a person like that into treatment and get them the help that they need as quickly as possible. It doesn't have to ruin your life to be stuck in a place where you're scared, you're all alone, you find out you're pregnant and you're struggling with addiction. That's a whole lot to take in all at once. And treatment centers are there to help. It's important to realize that when you go to treatment, it's likely that you'll get a therapist that's assigned just to you, a therapist that can help you work through various problems, connect you with different resources that you're going to need when you get out of treatment, not only in overcoming addiction and alcoholism, but also in dealing with the teen pregnancy. So this is a good starting point, especially for someone who's in that situation where they're at risk, they got multiple problems, their whole life is sort of crashing in on them, pregnancy, addiction. Go get the help you need, go to a treatment center. That's how you can start to build a foundation in treatment and start to get connected to the resources that can help you to get back on track and to rebuild your life. So get on the phone now, make that call, and turn your life around.